Now, let's try to apply some of the principles and concepts that we have been studying about and expanding more on some of the information that we talked about in the first video. So we're going to try to answer this question that I have posted here on the screen. So as a nursing student and a nurse, what do I need to know about a drug before I administer it to a patient? So the first thought that we really should focus on is, what does a drug do? How does it work? What is the mechanism of action of this medication? So I've given you a couple of different examples here, so that if you look at the left side, the mechanism of action of insulin, insulin acts as a key to the cell receptor site that opens up a gate or a channel where glucose can then enter the cell and metabolize once it's in the cell, causing additional energy for the cell. So the cell is going to need a constant supply of glucose to work. So insulin is the door or the key to the receptor site that allows glucose to go inside the cell for energy. If you look at the right side, you'll see an example that involves serotonin. And you may or may not know that serotonin really is an important neurotransmitter that serves to boost our mood, that keeps us going. It really kind of serves as stimulating us to be upbeat, happy, that sort of thing. So serotonin, unfortunately, moves from one neuron to the next, but frequently serotonin can be deactivated because it's sucked back up, or there's a term that's called reuptake back into the presynaptic neuron, that if you see and look at the beads of serotonin here that are trying to cross over to the next neuron, but you'll see that some of these are back reuptaked back into the presynaptic neuron. But if you're needing more serotonin to be released and uptaken, then we don't want to have a degree of uptake. So we want as much serotonin to cross over to the next side as possible. There are a group of drugs that are called SSRIs, that are selective serotonin reuptake inhibitors. So that's a big name and a long name, but what really ultimately SSRIs do are going to prevent or block the uptake of serotonin that actually increases the degree of serotonin receptors, so that more serotonin in the next neuron can be activated. So when we're taking SSRIs, it actually blocks the reuptake of the serotonin in the presynaptic neurons, so that more serotonin is available. So those are two ways that medications do their job. So it's always good for the nurse and the nursing student to know what the drug does, what does it do, how does it work, because that's impacted from disease pathophysiology. So the second thing we want to think about is, why is my patient taking this medication? So what is or are the indications for this drug? And this is information that we've learned in the first studies, so in the first lecture. So this got interesting in that minoxidil itself was initially marketed and used as an antihypertensive medication. So it was frequently used on people who were resistant to other medications. But we see now that minoxidil is a class of antihypertensives that's used for severe refractory hypertension. So for those patients, again, who have not responded to other medications like hydralazine or sodium nitroprusside, we save this medication kind of for those resistant or stubborn hypertensive patients. So again, it's used for severe cases. when there's no other way really to get the blood pressure down. It can be very effective for patients who are resistant. And some of the information that was discovered as this drug was used is that people began to notice that once they were taking these medications, that it stimulated hair growth. So minoxidil has another indication for hair regrowth treatment, for treating alopecia, particularly effective for individuals who are male and are already currently bald, or to prevent them from going, or prevent their worsening degree. So it has really two indications then at this point for hypertensive control and for alopecia control. So be careful about these medications that we're using on patients. So look at the backstory. What is the reason why, again, we are using this medication for our patients? We're not going to assume that everyone getting minoxidil is being given that for hair regrowth or for antihypertensive control. We need to be very, very cognizant about why is this medication being given to our patients. Frequently, there can be 2 or 3 indications for the medication. So you can see here that the importance of knowing why medications are being administered to our patients, knowing their history, and that sort of thing. So it's important to know that why we're giving the medications to the patient. It's far more important to look at the whole picture as opposed to a single area we're focused on. So the next thing that we have to be mindful of is what are the side effects or what are the adverse effects of the medication on the patient. So we know that adverse effects or side effects could be wanted or unwanted. So certainly adverse effects are most times always unintended, those medications. So again, I have listed your definitions here for you. The adverse drug reactions are really, can be any noxious or unintended or undesired effect. If you look over to the right with our patient here, we see the side effects of aspirins. We have patients who can be allergic to aspirin. We can see eyes or facial, lip, tongue, or throat swelling. And if we have a severe allergy, then people could develop angioedema that could impair their airway. So too much aspirin may cause some tinnitus or ringing in the ears, or loss of hearing, that really people can have significant deficits with that. We also know that with the allergic reaction to aspirin, we can have wheezing, difficulty breathing. They could be tachypnic. They could have a vocal change and be hoarse. They could be tachycardic. They can have some cold, clammy skin. They can break out in a rash or hives. And really another important thing to think about for aspirin is that it can cause some significant gastrointestinal bleeding. So we could have some emesis, or we can see bright red blood, or we can see coffee ground appearances of the emesis that could be hematemesis, or we could have black stool that is representative of melena, or maroon blood that is hematochezia. So we can have people that can have nausea or stomach pain or heartburn or vomiting associated with that. And frequently we administer aspirin with an enteric coated, or you may say aspirin -EC, that's going to prevent the breakdown of the medication in the stomach, so to prevent erosion from occurring in the stomach itself. So it may break down a little more gradually, and by the time the chyme or the fluid from the stomach gets into the small bowel, then through the duodenum, that it is now being broken down in that process. So next thing you want to do is ask yourself, does this drug interact with other drugs, or Are there foods that may be important that potentially could cause some problems? So we see here an example of Xanax, which is an alprazolam or an anti-anxiety medication. But we know that we have to teach our patients when they're taking Xanax or alprazolam that they can't drink grapefruit juice in conjunction with taking the medication, because grapefruit is going to increase the concentration of alprazolam in the blood. So we may have too much of a sedative, too much of a relaxation, too much of a respiratory potential depressant. So we don't want to mix also with kava that could cause some excessive drowsiness for patients and can lead to some pretty significant problems. Sometimes if we use herbal medications such as St. John's wort, we may have an interaction between Xanax or alprazolam and St. John's wort, and it's decreasing the effectiveness of alprazolam. So we have less of a therapeutic effect. So we know that alcohol will add to the components of alprazolam, and we know that the central nervous system may respond with an excessive degree of sleepiness, somnolence, drowsiness, a decreased ability to have motor skills. So we really don't want to add any kind of nicotine consumption if you're also taking Xanax, because it's decreasing the degree of effectiveness of the alprazolam. So all of these medications potentially have complications or potential interactions that is really important for patients to be educated on if they're taking these medications. And it's your responsibility as a nurse to make sure that your patients understand those interactions and complications, and that you're teaching that information for the patients. So what are some contraindications related to the drug? So are there some situations or other disease processes that or condition that may prevent the patient from being administered this medications? So there's a list here that we've provided for you that have a common occurrences or complications or contraindications to these medications. So certainly if we have people that have allergies to the medication, or if they're sensitive to the medication, they don't want to take some other drugs. So if medications are taken during pregnancy, there may be some complications to the fetus. There may be some teratogenic effects of the medication depending upon the trimester. Additionally, lactation, if the mother is breastfeeding, there is a contraindication in that the medication may be expressed in the breast milk. Additionally, if a patient has kidney disease or renal disease, there's no way to, there potentially may be complications that occur because the kidneys are not going to excrete the drug. And certainly if you have patients who have hepatic disease, then there's a decreased degree of metabolism, or if the patient has liver disease or liver failure, we may have potentially less metabolism of those medications, and certainly the medication systemically may increase significantly. So maybe there's an example here that you're familiar with the medication of Accutane that is used very effectively to treat acne. It is absolutely, though, contraindicated in pregnancy because of the potential birth defects. Really to the point that if a person is taking Accutane, we have to be very cognizant about the degree of potential risk for getting pregnant. So there has to be significant birth control, and one or two types of birth control. We do know that people who are on Accutane have to go in and have their blood checked on a regular basis, urine checked to make sure that they are not pregnant. So this is a good example of a contraindication for those medications. So again, some of the important implications again, that is important for you to think about here is what monitoring do we have to implement when we're thinking about medication. So here's an example for postmenopausal women taking Fosamax for osteoporosis. People have to take the medication on an empty stomach with a full glass of water, no food, no drink, etc., etc. Patients should wait 2 hours before taking any calcium products because of the sequestration of the medication. You can see how this medication potentially could cause some significant problems if we do not teach our patients about how they should or should not take their medications. So now what I want you to do is we're going to apply some of these things that we have learned. So I want you to take your textbook and look up the 5 different medications that I've included here. Kayexalate, nitroglycerin or Amdor, hydrochlorothiazide, Lopressor or metoprolol, and Fosamax. So what I'd like for you to do is for each of these medications, I want you to prepare your template, your medication templates, and you're going to find medication templates in the pharmacology course website. So what you're going to do is take this template, you're going to download 5 different templates, and then you're going to complete those based on each of these medications. So if you struggle to find some of these information and nursing interventions on these patients, you may need to utilize, trusted PDRs and those sort of things that really are going to tell you significant nursing interventions or nursing information for those medications. So complete those 5 templates with your name on them. Add them with your name and then bring them into class so that you'll have them and get credit for, number 1, watching this video, number 2, watching the first video, so that I know that you are listening to these, that you are paying attention, that you are focusing on the important concepts, because you're going to also be starting directly into your fundamentals clinical soon. So I have to make sure that you have a good understanding of how to go about medication administration, what are the important concepts, and what do you really need to know about those medications. So I look forward to seeing you guys in class, and let me know if you have questions. Thanks.